Hello students. Today, we will be diving into the fascinating field of otorhinolaryngology, specifically focusing on the evaluation and management of vertigo. Vertigo is a common symptom encountered in clinical practice, characterized by a spinning sensation and a sense of imbalance. It can severely impact an individual's quality of life, making accurate diagnosis and effective treatment crucial. Now, let us move on to our first topic of discussion. Evaluation of vertigo requires a comprehensive clinical assessment and diagnostic tests. History-taking and physical examination techniques aid in identifying vestibular dysfunction. Diagnostic tests like audiometry, ENG, VNG, VEMP, and MRI help confirm the cause of vertigo and rule out central causes. Benign paroxysmal positional vertigo, BPPV, is a common inner ear disorder caused by displaced otoconia. It leads to short episodes of vertigo triggered by head movements. Diagnosis involves the Hallpike-Dix maneuver, while treatment maneuvers like Epley and Semont maneuvers help reposition the otoconia, providing effective relief. Meniere's disease is a condition characterized by recurring bouts of vertigo, hearing loss, tinnitus, and oral fullness. Diagnosis is based on specific criteria, and the disease is caused by an increase in endolymphatic volume. Treatment options include lifestyle changes, medications, and, in severe cases, surgery. Vestibular migraine is a common cause of vertigo in patients with migraines. Episodes can last from minutes to days and are often accompanied by headaches. Diagnosis requires a history of migraines meeting specific criteria and ruling out other causes. Treatment involves lifestyle changes, avoiding triggers, and medications such as beta blockers, calcium channel blockers, tricyclic antidepressants, and antiepileptic drugs. These medications have been shown to reduce the frequency and severity of vertigo attacks. Vestibular neuritis is commonly caused by viral inflammation of the vestibular nerve. Patients present with a sudden onset of prolonged vertigo, often associated with nausea, vomiting, and unsteadiness. It is important to differentiate vestibular neuritis from other central and peripheral causes of vertigo, such as stroke or Meniere's disease. Management of vestibular neuritis is mainly supportive, focusing on symptom relief during the acute phase through the use of antiemetics, vestibular suppressants, and physical therapy exercises aimed at vestibular rehabilitation. The majority of patients experience spontaneous resolution of vertigo over time. While most cases of vertigo are peripheral in origin, it is essential not to overlook central causes, as they often require immediate intervention. Recognizing central causes, such as stroke, multiple sclerosis, or brainstem tumors, can be challenging due to overlapping clinical features. Diagnosis involves a thorough neurological examination, including detailed cranial nerve evaluation, assessment of motor and sensory functions, and imaging studies such as brain MRI. Prompt referral to neurology or neurosurgery specialists is crucial for further evaluation and management. MDDS is a rare condition where individuals experience ongoing rocking or swaying sensations after motion exposure. The cause is unclear, but it may involve malfunctioning of the vestibular system. Diagnosis is based on specific criteria, and treatment options include medications, exercises, and transcranial magnetic stimulation. However, treatment remains challenging due to limited evidence. Superior canal dehiscence syndrome, SCDS, is a rare condition where abnormal sound and pressure transmission occurs within the inner ear due to a third window in the bony labyrinth. Symptoms include vertigo, hearing loss, autophony, and oscillopsia. Diagnosis involves clinical history, audiological evaluation, VEMP testing, and CT scan. Surgical management can provide relief for severe cases. Acoustic neuroma, also known as vestibular schwannoma, is a benign tumor arising from the Schwann cells of the vestibular nerve. Patients may present with asymmetric hearing loss, tinnitus, and vertigo, among other symptoms. Early recognition is essential to ensure timely management and prevent complications. Diagnostic workup often includes audiometry, gadolinium-enhanced MRI of the internal auditory canal, and vestibular function tests. Treatment options depend on the tumor size, patient age, symptoms, and hearing preservation goals. Options range from observation and serial imaging to microsurgical resection or radiosurgery using techniques like gamma knife or cyberknife. Autoimmune inner ear disease, AIED, is a rare condition where the immune system damages the inner ear. Symptoms include hearing loss, vestibular issues, and tinnitus. Diagnostic procedures include clinical evaluation, audiological testing, and serological markers. Treatment involves corticosteroids, immunosuppressants, and biologic agents. Early intervention is crucial. Malformations of the inner ear encompass various congenital anomalies affecting the cochlea, vestibular apparatus, or both. These anomalies may be isolated or associated with syndromes. Timely identification is important due to potential implications on hearing and balance function. Management considerations depend on the specific malformation and associated clinical features. Treatment options can range from supportive measures, such as hearing aids, to surgical interventions, such as cochlear implantation or vestibular rehabilitation. Pharmacological treatments play a significant role in managing vertigo symptoms. Antiemetics, such as dimenhydrinate or ondansetron, help alleviate nausea and vomiting associated with vertigo. Antivertiginous agents, including beta-histine or meclizine, aim to reduce vertigo episodes and improve vestibular compensation. The mechanisms of action of these medications vary. Antiemetics act by blocking specific neurotransmitter receptors involved in triggering nausea and vomiting. Antivertiginous agents often modulate histaminergic or dopaminergic activity in the central nervous system, thereby reducing vertigo symptoms. In conclusion, managing vertigo requires understanding its causes, diagnostic techniques, and treatment strategies. Collaboration among specialists is crucial for optimal care. Continuous learning is essential for future practice. Keep up the great work.